Hey team, today we're going to learn how to do a digital block. A digital block is pretty much just what it sounds like. You're going to numb a finger or a toe up. You're going to do that because that finger or toe is injured and the patient doesn't really need fentanyl. They need the finger to be numb. So we have our equipment here. We have an alcohol pad. We have our lidocaine that we have on the truck. We have a syringe, a stopcock, a needle to get the medicine into the finger, and then a gauze pad. So pretty straightforward. Let's say my ring finger is injured. We're gonna clean up the area of injection here on the dorsal side. I also, you would be wearing gloves. I also will do the palmar side here, clean it up. You would have this drawn up already, but for teaching purposes, we'll pull out our lidocaine. This is going to be 20 milligrams per mil. We look at the expiration date, make sure we have the right med, and get our medicine up. Stopcock, pull our stopcock out of here. Because you point it to where you don't want it to go, so we are going to point it this way. Hook our medicine on. Get our syringe. Hook our syringe on. There we go. You can push or pull or both. We'll get 3 mils in there. And then I'm done with the stopcock. Set that aside. Get my bubble out here. Then we're going to put our needle on. And we have 23 gauge needles on the truck. It'd be best if we had 25 or 27. I'm going to use a 25 since I'm going to do it on my own finger. I don't have a real bad injury right now. So we'll pull the needle out. Again, I'd be wearing gloves. Put that on. So classic timing. Dr. Miramontes will have to wait just 1 second. Again, we've cleaned this here. And so this is my injured finger, my ring finger. You can hold the patient's hand how you want. If you need to move closer here. But there's a nerve here and a nerve here. And there's a nerve here and a nerve here. So there's 4 nerves total. So you're trying to numb the nerves up. So if we're going from the back side, you poke right here, push down in the side. Now, you want to try to not poke through the back side here, but you can see it's tenting, so that's good. So we're going to push 1 mil of medicine. We're going to do that on the way out. And then all the way up to the top, 0.5 to 1 mil. And then we're going to do the other side over here. And another poke. And all the way down, but not coming out the back side again. And numb those nerves up. Boop, on the way out. Set your needle side, put it in the sharps. And then we're going to obviously take a gauze pad and help with anything. Now, one thing you do want to do, it is helpful to kind of massage that medicine in there a little bit to numb up the finger. And what'll happen now, put a little Band-Aid on it. You can see there's not much bleeding. It's such a small needle. What'll happen now is my finger will be numb all the way out to the end. So it's already starting to get numb. That's how fast it works. And this is great because someone cuts the end of their finger off with a weed eater, lawnmower, knife, something like that. My finger's already going numb. You need to get a fish hook pulled out of someone's finger. This is a great way to do it. So this is a very safe, very effective way where we wouldn't have to use fentanyl on a patient that had a serious finger or toe injury. Again, this is called a digital block. This is the procedure I just showed you is coming from the dorsal side here of numbing. There's another way we can do this, and I won't do this here, but basically you can insert here, push in, and then you're going to insert again a mil or two and that will follow the tendon sheath all the way up and numb the finger. And you just need one injection when you do it on this site. I've always had better luck with this double injection back here, but this is just a matter of personal preference. And that'll conclude our digital block teaching.